I've spent 30 years in emergency rooms, and there's a sound I'll never forget: the silence when someone arrives too late. Here's the truth no one likes to talk about. Most people over 60 do not survive their first heart attack if they're alone. Not because they couldn't be saved, but because they didn't know what to do. Nearly half of heart attack deaths happen before reaching a hospital. People wait, they doubt themselves, they tell themselves it's just indigestion. Minutes pass, and minutes cost lives. I've watched families cry over patients who could have survived if just one decision had been different at home. Chest pressure, breath stolen away, cold sweat, the room spinning. By the time they arrive, the chance is gone. But listen, this doesn't have to be your story. There are simple, science-backed actions you can take, even alone, that can double your survival odds. Real medicine, real evidence. In this video, I'll show you 7 life-saving steps every senior must know to survive a heart attack when no one is there to help. These are the steps I wish my patients had practiced. And number 3, don't skip it. It can decide whether you live with permanent damage or walk out of the hospital. Sources are linked below. Before we start, how old are you? Tell me in the comments. Now, let's begin. Number 7. Call emergency services immediately. This is the most important step. Not one of the most important, the most important. If you remember nothing else from this video, remember this: call emergency services immediately. Not later, not after you see how you feel, not after you lie down for a few minutes. Immediately. I've worked in emergency medicine for decades, and I can tell you something that never changes. People don't die because help isn't available. They die because they wait. They hesitate. They doubt themselves. They don't want to overreact. And that hesitation costs lives every single day. I've heard it all. Maybe it's just indigestion. I don't want to bother anyone. I'll wait and see if it goes away. I don't want to be embarrassed. Let me be very clear with you. Your heart does not care about embarrassment. Every minute you wait, heart muscle is dying. Cardiologists put it simply: time is muscle. That's not a slogan. That's biology. When a heart attack begins, a blood vessel becomes blocked. Oxygen can't reach part of the heart, and without oxygen, heart tissue starts dying within minutes. Not hours, minutes. According to the American Heart Association, people who call emergency services within the first 5 to 10 minutes can have survival rates up to 50% higher than those who delay. But here's the heartbreaking reality. Nearly 1/3 of people over 60 wait more than 2 hours before calling for help. 2 hours. By then, the damage is often severe or irreversible. And why do they wait? Not because they don't feel symptoms, but because they talk themselves out of acting. I've stood in ER hallways watching stretchers roll in, knowing, before tests were even run, that if this person had called earlier, the outcome would have been very different. Let me tell you something important. You are never wasting time by calling emergency services for chest symptoms. Never. Paramedics would rather evaluate you and find nothing wrong than arrive too late when something could have been treated. If you feel any of the following, act immediately: pressure, tightness or heaviness in the chest, shortness of breath, nausea or vomiting, pain spreading to the arm, jaw, neck or back, sudden dizziness or weakness, cold, clammy sweating. These symptoms don't always come like a movie scene. Sometimes there's no dramatic chest pain. Sometimes it feels vague, uncomfortable, off. That's especially true for older adults. So here's the rule I want you to remember. If it might be a heart attack, treat it like one until proven otherwise. Even if it turns out to be acid reflux, even if it turns out to be anxiety, even if it turns out to be nothing, you lose nothing by calling. But if it is a heart attack, and often it is, you may have just saved your life. Another critical point: do not drive yourself to the hospital. Call emergency services. Why? Because paramedics can begin treatment the moment they reach you. They can monitor your heart. They can give oxygen, aspirin, medications. They can alert the hospital before you arrive. If your heart rhythm becomes dangerous on the way, they can act immediately. Your car cannot do that. And please hear this clearly. If you live alone, calling early matters even more. Many fatal heart attacks happen because someone collapses before help is on the way. Calling early gives you a lifeline. It gives your heart a fighting chance. I want to address something emotional because it comes up all the time. Many older adults worry about being a burden. Let me tell you the truth. Your life is never a burden. Your family would never forgive themselves if you waited too long because you didn't want to bother them. Doctors, nurses, and paramedics chose this work for moments like this. You are not interrupting us. You are doing exactly what you should do. So make this promise to yourself right now. If you feel warning signs, you will call. No debating, no waiting, no downplaying. Just one decision. That single decision, picking up the phone, has saved more lives than any medication I've ever given. This step doesn't require strength, it doesn't require medical knowledge. It requires courage. And you have that because protecting your life is not overreacting. It's wisdom.
Number 6. Chew an aspirin, if not allergic. Once you've called emergency services, there's one simple step that can make a real difference. Chew one aspirin. Not swallow, chew. That detail matters more than most people realize. When a heart attack begins, a blood clot is usually blocking blood flow to part of the heart. Aspirin works by slowing down clot growth, helping keep blood moving through that narrowed vessel. This isn't theory, this is proven medicine. A landmark study published in The Lancet found that taking aspirin during a heart attack reduced the risk of death by 23%. That's not a small number, that's lives saved. Now, here's the part many people don't know. Chewing aspirin works faster than swallowing it. When you chew the tablet, it begins absorbing through the lining of your mouth and stomach almost immediately, often within minutes. Swallowing delays absorption, and during a heart attack, minutes matter. That's why emergency doctors and paramedics tell patients to chew it. The typical recommendation is one uncoated 325 milligram aspirin. Uncoated is important. Coated or enteric aspirin takes longer to dissolve, which slows down its effect. But let me be very clear about safety. This step is not for everyone. Do not take aspirin if you are allergic to aspirin, you have a known bleeding disorder, you've been told by your doctor not to take aspirin. If any of these apply to you, skip this step and wait for emergency professionals. Never take aspirin just in case if you've been advised against it. But if you can safely take aspirin, this single pill can buy you precious time while help is on the way. I've seen it firsthand. Patients who took aspirin early often arrived with less damage and better outcomes than those who didn't. It doesn't cure a heart attack, but it can slow the damage. That's why I recommend this to every patient who is eligible. Keep aspirin within easy reach in your home, not buried in a cabinet, not locked away, somewhere you can reach quickly, especially if you live alone. And one more important reminder, aspirin is not a substitute for calling emergency services. Never take aspirin and wait it out. Call first, then chew the aspirin. Think of aspirin as buying time, not fixing the problem. That one small pill, taken correctly, can help keep blood flowing long enough for doctors to do what they do best. It's simple, it's evidence-based, and it saves lives.
Number 5. Sit upright and loosen tight clothing. This step may seem simple, but it's more important than most people realize. Do not lie flat. Instead, sit upright with your back supported. A chair is ideal. The edge of a bed works. Even the floor, as long as your back is against something solid. Now, once you're sitting, loosen anything tight. Unbuckled belts, loosen waistbands, open tight collars or buttons. Anything that restricts your breathing or blood flow needs to come off or loosen up. Here's why this matters. When you're having a heart attack, your heart is already struggling. It's working harder than it should, often without enough oxygen. Your position can either help or make things worse. Sitting upright helps in 3 critical ways. First, it makes breathing easier. When you sit up, your lungs can expand more fully. Oxygen moves in and out more efficiently, and better oxygen levels reduce stress on your heart. Second, it reduces pressure on the lungs. When you lie flat, fluid can back up into the lungs. That can make you feel like you're drowning or gasping for air. Sitting upright allows gravity to help keep your lungs clearer. Third, it lowers the strain on your heart. Lying flat increases the amount of blood returning to the heart all at once. During a heart attack, that extra workload can be dangerous. Sitting upright reduces that sudden pressure. I've seen this countless times in emergency rooms. Patients who stayed upright and calm often arrived more stable than those who lay flat and struggled to breathe. And here's something many people don't realize. Lying flat can increase the risk of sudden collapse. If your blood pressure drops or your heart rhythm becomes unstable, being flat can make it harder to stay conscious. Sitting upright gives your body a better chance to stay alert while help is on the way. This step doesn't require strength. It doesn't require medication. It just requires knowing what to do. If you're alone, this positioning can make a real difference during those critical minutes. One more important point. Once you're seated, stay as calm and still as possible. Avoid walking around, avoid pacing, avoid lying down just for a moment. Movement increases your heart's demand for oxygen, and right now, oxygen is exactly what your heart is short on. Sit, support your back, loosen tight clothing, and breathe slowly. This simple position helps your body work with you, not against you. It's a small step, but during a heart attack, small steps can mean everything. Number 4. Cough forcefully if you feel faint. This step surprises a lot of people. It may sound strange at first, but it's real and it's used in emergency medicine. If you suddenly feel dizzy, lightheaded, or like you're about to pass out, do this. Cough. Hard. Repeatedly. Doctors sometimes refer to this as cough CPR. Now let me be very clear before we go further. This is not a cure for a heart attack. It does not replace calling emergency services, and it does not fix the underlying problem. But in the right moment, it can buy you precious time. Here's why it works. When you cough forcefully, you create pressure inside your chest. That pressure helps push blood out of the heart and toward the brain. In simple terms, strong coughing can temporarily help maintain blood flow to the brain, which can help you stay conscious. During a heart attack, the heart's rhythm can become unstable. Blood pressure can drop suddenly, and that's often when people faint or collapse. If you lose consciousness while alone, your chances drop dramatically. This technique is about staying awake long enough for help to arrive. I've seen patients who stayed conscious because they acted quickly, and others who didn't get that chance because they blacked out first. Here's how to do it correctly. First, take a deep breath. Fill your lungs as much as you comfortably can. Then, cough hard, as if you're trying to clear something stuck deep in your chest. Not a gentle cough, a strong, forceful one. Then repeat. Deep breath, hard cough. Aim for one strong cough every 2 to 3 seconds. Keep going until the dizziness passes, emergency services arrive, or you're instructed otherwise by medical professionals. If you're seated upright, as we discussed in the previous step, this works even better. Now, an important warning. Do not use this technique if you're not feeling faint, and do not delay calling emergency services to try this. Call first, then use coughing only if you feel like you're about to pass out. Think of this like a temporary bridge. It doesn't solve the problem, but it helps you stay on your feet long enough to reach help. Another important point. This technique is most useful early when you're still alert and able to follow instructions. That's why knowing it before you need it matters. When panic hits, clear thinking disappears, but practiced knowledge stays. So remember this. If dizziness hits suddenly, if your vision starts narrowing, if you feel like you might black out, deep breath, hard cough, repeat. Those few extra seconds or minutes can make the difference between staying conscious and collapsing alone. And during a heart attack, staying conscious can save your life. Number 3, unlock your door and keep your phone nearby. This step saves lives. I'm not exaggerating when I say that. Unlock your door immediately. Do it as soon as you've called emergency services. Because during a heart attack, every barrier costs time, and time in this situation can be deadly. I've watched paramedics arrive quickly only to lose precious minutes because they couldn't get inside. They knock, they call out, they try to force entry. And while they're doing that, your heart is still struggling. Those lost minutes matter. Even the fastest response can't help if the door is locked. So make this a priority. Unlock the door. If possible, open it. If you can safely do so, unlock the main door and leave it slightly open. If not, unlock it and stay seated nearby. This one small action removes the biggest obstacle between you and life-saving care. Now let's talk about your phone. Keep your phone within arm's reach. Not across the room, not on the charger down the hall. Right next to you. Put it on speaker if you can. Your phone is not just a device in this moment. It is your lifeline. Emergency dispatchers are trained to guide you step by step. They can keep you calm, they can tell you what to do next, and if your condition changes, they can act immediately. If you suddenly feel worse, if you feel faint, if you struggle to breathe, they need to hear it. And if for any reason you stop responding, an open line tells them something is wrong. I've seen cases where that open phone line helped paramedics move faster because they knew time was critical. This step is especially important if you live alone. Many heart attack deaths happen not because help wasn't called, but because help couldn't reach the person in time. A locked door, a phone left behind, two simple things that can change everything. So remember this image. Your phone is the lifeline. Your unlocked door is the bridge. Together, they let help reach you as fast as possible. And here's something I recommend to everyone. Do this before an emergency ever happens. Make sure your door locks are easy to open. Know where your keys are. Keep your phone charged. Practice putting it on speaker. Preparation removes panic, and panic is the enemy in moments like this. So if you ever face this situation, don't wait. Unlock the door. Keep the phone close. Stay where you are. You're not alone anymore. Help is on the way. Number 2, take slow, deep breaths. Panic is one of the most dangerous things during a heart attack, not because it means you're weak, but because panic forces your heart to work harder at the exact moment it needs relief. When panic hits, your body floods with adrenaline. Your heart rate jumps, your blood pressure rises, your breathing becomes fast and shallow. All of that increases strain on the heart. So after you've called for help, unlocked the door, and sat upright, do this next. Slow your breathing. You're not trying to breathe more, you're trying to breathe slower. Here's how. Gently inhale through your nose. Let the breath fill your lungs slowly. Then exhale through pursed lips as if you're blowing out a candle. Long, controlled. Now pause for a moment and repeat. Your goal is 6 to 8 slow breaths per minute. That's much slower than normal breathing, and that slowness is powerful. Each slow breath does 3 important things. First, it increases oxygen. More oxygen in your blood means less stress on your heart. It helps your heart muscles survive until help arrives. Second, it lowers stress hormones. Slow breathing tells your nervous system that you're not in immediate danger. Adrenaline levels drop, your heart rate begins to settle. Third, it reduces strain on the heart. A calmer body means less work for an already struggling heart. I've watched patients calm their breathing and stabilize, and I've watched others spiral because panic took over. The difference isn't toughness, it's control. If your thoughts start racing, anchor yourself to the breath. Inhale, slow. Exhale, slower. You don't need to be perfect, you just need to stay steady. Think of each calm breath as buying time. Time for blood flow, time for oxygen, time for help to arrive. You're not fighting the moment, you're guiding yourself through it. So stay seated, keep breathing slowly, and remind yourself, help is coming, and you're doing exactly what your heart needs right now. Number 1, stay calm and stay still. This is the most important rule of all. Everything else supports this. Stay calm, stay still. Do not pace, do not walk it off, do not try to push through. Every unnecessary movement forces your heart to work harder, and right now, your heart is already under strain. When people panic, they move, they stand up, they walk around, they search for distractions. But movement increases oxygen demand, it raises heart rate, and it speeds up damage. Studies consistently show that patients who remain calm and still during a heart attack often have better outcomes than those who don't. Not because they're stronger, but because they conserve energy. Stillness gives your heart a break. Calmness lowers adrenaline. It slows the heart. It reduces blood pressure. And that creates the best possible conditions while help is on the way. I want you to repeat this to yourself, out loud if you can. I've called for help. My only job now is to stay still and breathe. That sentence matters. It gives your mind a single focus, and focus prevents panic. Sit upright, support your back, let your arms rest comfortably. Then return to your breathing, slow and steady. You are not helpless in this moment. You are actively protecting your heart. Stillness saves energy, calmness protects your heart, and time saves your life. Help is coming, and right now, staying calm and staying still is the strongest thing you can do. These 7 steps aren't random tips. They form a survival map. You may never know the moment a heart attack will strike, but knowing how to act in those first minutes can be the difference between tragedy and survival. Because when it comes to the heart, minutes matter. Knowledge matters. Preparation matters. You don't need medical training. You don't need special equipment. You just need to remember what to do and to act without hesitation. If even one step from this video stays with you, it could one day save your life or the life of someone you love. Now I want to hear from you. Where are you watching from today? Do you keep aspirin at home? Do you have an emergency plan in place? Leave a comment below. We read and reply to every single one. And please, if this information could help even one person you care about, like this video, share it, and subscribe for more evidence-based, life-saving guidance. One share, one conversation, one moment of preparation. That's how lives are saved. Stay safe, stay prepared, and remember, knowledge is power, especially after 60.